Hi, I'm Megan. I'm here with Grace, Gianna, and Ben, and we're pitching our idea for a biodegradable scaffold meant for burn wounds that is both addressing and promotes healing. So, to put this in perspective, we are looking for our products meant to be used in a low resource environment, for example, like a conflict zone or a war zone. So, over 50,000 deaths per year occurred due to armed conflict, with civilians making up 90% of people harmed in conflict. And then for burn wounds specifically, 5 to 20% of these wounds are burn injuries, and 95% of burns in general occur in low middle income countries. So the gap in care is that there's no combat ready treatment options that are for these low resource environments that combine infection control and have the mechanical strength to be a scaffold that promotes regeneration.
So how will we be fixing that problem? We want to be able to design a bioresorbable scaffold that will combine all of those things mentioned in the gap. We want it to have infection control, the mechanical strength needed to maintain the wound, and also a reduced pain process. It's also made to be used, as mentioned, in a low resource environment, so are really concentrating right now on the burn injuries sustained by both soldiers and civilians during conflict. This here is what we submitted in our first homework here. We're going to blow it up in a second. So to get into some more specifics, on that first patient contacting layer, we're going to use a carboxide methylcellulose hydrocolloid microbeads suspended in a gelatin. This is mostly meant to promote healing. It maintains moisture as well as helps solidify the scaffold to the body. And it would be very thin. It also will help if there's any shrapnel left over. Nothing large, smaller pieces would be able to be drawn out by this hydrocolloid. It will then be topped by a PLGA scaffold. We're looking at a 1.5 millimeter thickness and at an 85% concentration. This 85% concentration ensures that the scaffold will maintain before resorbing for 3 to 6 months, so it'll last throughout majority of that healing process. It'll also help mitigate all of the needed for dressing changes. And then as far as design, we're going to do fenestrations. This will allow for oxygenation as well as transport of different fluids, which are pretty common for the burn healing process. We're also going to have the edges be curved to allow a higher contacting surface area, and we're also going to feather them to allow for more integration and less lifting around those edges.
Perfect. So the benefits of our design, starting off, like Grace was saying, we do have improved pain management with the complete wound dressing and regeneration components. So with other competitors, there's more so daily dressing changes with what's being applied for the burn healing process, whereas our design will be laid down once, adhered, and then not require removal and new dressings to be applied. So with daily dressings, most burn patients report about a 40% pain spike during that switching, whereas our approach will have no dressing changes, so a complete reduction of that pain to 0%. We also, with our design having about 1.5 millimeter scaffold, the thin material allows for flexibility and stretching with our fenestrations, which will allow it to conform over the complete wound site with like one standard dimension of length and width. And also, the purity of the PLGA will allow the long scaffold persistence throughout the complete healing process, which will further support the no need for dressing changes, while also no secondary wound site for any sort of grafting compared to our competitors. And for our cost breakdown, our three main components, like Grace was said, was the CMC embedded in the gelatin with the PLGA at our 85% purity. So looking at some bulk unit cost, it's about $2 per kilogram, 25 per kilogram, and then 88 per gram. So our PLGA is our main cost in this design, but with the amount used for our dimensions of about 10 centimeters by 15 centimeters, the complete cost is only at about $450 per unit. And also compared to the average medical cost per patient at about 1,500 up to 20,000, it's just a complete more cost-effective method of treatment.
So regarding current treatment options, both clinically and in the field, the gold standard for treatment of burn wounds is a graft, a skin graft specifically, which in the case of autografts actually induces secondary wounds, which is not a benefit of this treatment. and there can be limited supply, particularly for large total burn surface area patients. Biodegradable hydrogel scaffolds are also potential options, which are oftentimes not field deployable and can incur ranging costs. For example, this high stem hydrogel dressing goes for $217 for 7.5 milliliters. And then for dressing options specifically, the newest treatment is transforming powder dressing, which is a hydrogel powder, which upon hydration will aggregate into a wound dressing, which actually incurs lack of breathability, and the effectiveness is decreased based on the depth of the burn wound. And then general wound dressings, like we mentioned, will require frequent changes, which incurs lots of pain for burn patients and a host of other potential issues.